Every clinic you go into, they all hand you a clipboard. You're putting that same information in over and over and over.
Welcome to Unjargoned, a podcast about healthcare workflows that make sense and without all the annoying acronyms. We talk to people on the front lines of healthcare and explore cool workflows that they are using to solve real problems. Hi, I'm Sam Salvaggio. I'm a designer here on the Luma marketing team, and I'm filling in for Angie Shin as a guest host, and fingers crossed they asked me back. But I'll try my best to bring her infectious energy and hype to the table. I'd like to pass this over to Dave now for his intro.
Hey, everybody, I'm Dave Smith. I'm the resident nerd of all things trying to make the complication of being a patient, trying to get great care, and helping institutions just do it in a profitable way in which they can continue to support their communities. And I'm just really, really excited for today's show.
I'd love to introduce our amazing guest, Kurt Schmidt. He is the director of Electronic Health Records, which I realize this is now an acronym, EHR, at the amazing Phelps Memorial Health Center in Holders, Nebraska. Not only is he a huge proponent of technology and is single-handedly responsible for pushing Phelps forward, but he's also, fun fact, a celebrity in Kearney as the newly appointed city council member. So welcome, Mr. City Council Member Kurt. How are you doing today?
I am doing really well today. So thank you for the intro and also the fun fact. I got elected in at the Kearney City Council back in November. So it's been 8 months now, and so far so good. Yeah, it's been interesting. It's been kind of a lifelong deal for me now that my kids are gone and, I got some extra time. I said, I'm going to throw my name in the ring, and I was fortunate enough to get elected, and so it's been good.
So 2032?
2032, actually, to be, every 4 years, so 2029.
No. 2032, there's another election that might.
I want to stay local, so I don't need to go even state level. I'm happy where I'm at this point.
Everyone says
you,
that.
You wouldn't believe, Kurt is the biggest Nebraska fan out there. I had the privilege of visiting Phelps about a month ago and learning all about Nebraska and all of the good things about it, and the whole how knee-high by the 4th of July is no longer a thing. So Kurt, I did want to check in with you. How high is the corn now? Like, how are we doing corn-wise?
It's at least 8 feet. Some of the corn around here is even taller. It's been a good year. Been a good year for the corn. Everything's tasseled now, so it's at its max height, and everything's looking good. So knock on wood, we don't get hail in the next few weeks here, and we'll have a good crop.
Amazing. I know I'm personally also knocking on wood to never get hail, so that works out great.
So
unfortunately, we get quite a bit of it around here.
Oh my gosh.
So Kurt, you just hit on something, right? Which is, hey, weather changes, weather patterns change. Y'all are situated in an area of not only just growth, but loyalty. Maybe just unpack what happens in your brain as the leader of arguably the most mission critical system, okay, to ensuring that healthcare can continue. How do you think about providing healthcare? Here we are in the summer, good weather. Just unpack that for us for a minute.
Sure.
Big, super short question. Just jump right in there, Kurt. No worries at all.
No, that's okay. Yeah, it is a big deal. The weather plays a role in people's healthcare in central Nebraska. We have a lot of farmers and a lot of people that work for the farmers. And during this time of year, those people aren't coming in to get their knees and hips replaced. They may be putting off some of their preventative stuff. So, anything we can do to make things quick and easy for them when they do have to have something taken care of during the growing season or during the busy season, we need to make that available for them. And so that kind of goes back, how we started with you guys with just the reminders and the ability to message them. Anything we can do to make their lives easier, make them be able to get in and out of the clinic, if that's what they're coming for. Maybe it's some imaging that they need done.
Mm-hmm.
Anything that we can do to make that quicker is huge. Because once harvest is done, then that's honestly our OR's busiest time of the year. From,
Mm,
mid-October to December 31st, we're replacing a lot of hips. We're replacing a lot of knees. We're doing back
sure.
surgeries. All those things that were put off. With insurance, how it is, that's the busy time because they got their deductible met from something else that happened previous in the year, and so they want to get that done. So yeah, the weather does make a difference for us.
Mm.
What do you think are the most topical problems to be able to see a physician during that busy window?
Every clinic you go into, whether it's your primary care, whether it's a specialist, whether it's an orthopedic, they all hand you a clipboard. Some are switching over to an iPad, but you're putting that same information in over and over and over. And even
Hmm.
within our hospital, when we have the specialists come in, they have their own separate forms. And that's a complaint we get all the time from patients. Like, I gave you guys that information last week. Well, you were in our building, gave us that information, but
Right.
it went with that specialist when he went back to wherever he came from, whether it was Lincoln, Omaha, Denver, wherever we brought that specialist in from. So in the patient's eyes, they see that, they fill that out. Everybody should now have it. And that isn't how it always works. We do our best to minimize that. We've looked at doing some online forms, but then again, that still just goes into our system. It doesn't populate the specialist system. So we can
Mm.
make a lot of money if we figured out some way to integrate all of those records together for people. I know we're closer, but we're still a long ways away from it.
So you talked about reminders. Reminders are a little bit table stakes these days. I think any health system needs to be sending a reminder to somebody, because if they're not doing that, then it's a little bit like not having toilet paper in a restroom. But you all in particular, every 6 months, you're thinking of a new innovative way. I would love for you to just unpack for our audience, how do you think about identifying a problem and then thinking about, could Meditech or Luma tackle this problem?
Ever since we've signed on with you guys, we've continued to grow our messaging and just taking our main problem that we had when we signed on with you guys was just getting reminders to our clinic patients. That's all we really cared about. And so that was step one. And then other departments saw what we could do for the clinic patients, and they're like, hey, can we send reminders to the specialty clinic patients? Like, sure, we just need to turn it on. What do you want the message to be? And then we had like our imaging department. They were a little hesitant for reminders because some of the imaging times move around and they didn't want that set in stone. But as they saw other departments using the reminders, for example, or the two-way communication that we can do through text as well, we continued to add new departments into that. So our imaging department is now using reminders. Our clinic, like I said, our specialty clinic, we have our ortho spine clinic that is all using the reminders. And the cool thing that we did here just recently is we sat down at the table and said, okay, now some of our patients are getting 2 and 3 reminders for the same day because they're coming in and they're seeing their primary care physician. While they're here, they're going to get their labs drawn. And then they also need to get a CT scan, for whatever reason. And so those are 3 separate appointments in the Meditech system. And so the way we had it configured was for each appointment, they got the reminder for it. Well, for those patients that were a little more complicated, it was a little bit of too many reminders going to them.
That's a lot
And
of
so
text. That's a
that's a
lot
lot of
coming your
text.
way. Like, you're
Yep.
aware that you have the 3 appointments, but that's a lot coming your way. I totally
Yep.
understand that.
So we worked with the Luma team and said we want to combine all those appointments into a single text. So we worked on it in the test system, got it how we liked it, and we just turned it on here last week, and it's been going really well. So now the patient gets a message at the time of their first appointment. So maybe they have their imaging appointment at 8:30, but their primary care doctor's at 10. They get at 8:30 a text that says, you have these appointments with PMHC and this doctor at this time, imaging at this time, and your lab work at this time. And it goes to them in one text, and then they're able to confirm it with one reply, and it confirms all of the appointments in Meditech. So it's a game changer. I didn't realize how many people had multiple appointments in a day until we started looking at this and started talking to different people throughout the hospital. And like, yeah, we send patients down to lab all the time after they're done with their primary care doc.
One of the things that I think is really fascinating about your business is the value of the community that you serve and the network community of family practices, others that are, that are really dependent on y'all as an area of that level of care that they may not be able to provide. So that's referrals, faxes, things like that.
Yep.
Walk us through, why did you even think that's a problem? Why did you think it's a problem, but we should do something about it now? And why did Luma pop into your head as an alternative to solving that problem?
I'll go down the road of the faxes. Faxes in healthcare are just a necessary.
A tale as old as time. Yep.
Yes. Yeah. And unfortunately, I don't see them going away in the foreseeable future. I think just because of HIPAA laws, they don't allow you to email any patient information. So everybody's like, oh, just send it to me in email. Well, I can't because that's unencrypted. If that gets in the wrong hands, you type in the wrong email address, I mean, you can also type in the wrong fax number, but it's just the way healthcare is at this point. And so we were looking at ways to possibly streamline some of these faxes because we literally get hundreds of faxes a day. We have in our HIM team, there's a couple of them that dedicate a large majority of their day just dealing with faxes. And there's people on the other side of that fax machine that's doing the exact same thing for their clinic or their hospital. And so we looked at how can I do some of these tasks that are repetitive and get the information into the chart faster. It was kind of an initiative by our senior leader team. They're like, AI is coming. What AI can we use today that we can kind of get the ball rolling on? And when I talked to Aditya about it, I believe we were out at the Meditech conference out in Boston. And I was telling him, this is kind of what we're looking at. AI was the big push that year. And he's like, well, funny you should say something. We're working on that. And I'm like, perfect. And, so it was good timing for the Luma team. It was great timing for us. And it was an easy transition. I thought there might be a little bit of pushback from our HIM team because, that's the way we've always done it type, thought process. But they've been very receptive to it. Once she got comfortable with it, the other departments started asking about it. So now we have our clinic reception team that deals with faxes for orders coming in and that kind of stuff. They're using the fax transform. And we've got other departments that are considering it. Our registration department is considering using it because they process a lot of faxes on scheduling of appointments, and because those all come in via fax. And so, as people learn more about it and find that the workflow helps them with their day, everybody's eager to be able to process items, whether it's faxes, whether it's reminders, whatever that comes across their desk. If they can process them quicker and be able to do more of them so that their desk is cleaned off at the end of the day, that's where we want to go with it.
What's the biggest difference between what faxes and those hundreds that are coming in every day? What did that look like before compared to now for your team?
So before, some of them were physically coming in on a fax machine, and they would have to take that fax to a doctor for their review. Maybe they need a signature on it for a referral. So there was a binder that this fax got put into. It got walked across the building over to the providers, and then they physically had to review them. There was other faxes that came in electronically that just needed to be put into the Meditech chart, and so they would use the upload feature inside of Meditech to upload those into the chart. and then tag the provider on it so that they knew that there was a new document on that patient's chart.
And all of
So
this is just time. This is just adding up day after day, minute after minute. Part of their day is just completely inundated with these taxes or faxes. Like
yeah,
I can't even imagine that. It sounds like the worst.
yeah, it's not an enjoyable part of their job, that's for sure.
Mm-mm. So what does that look like now then with still the same amount that are coming in every day?
What's really
Like how,
changed is the electronic ones. And that's the majority of the ones we get. It's informational. They went to see a specialist in another town. And so that we get the report back on that. They had some imaging done at a third party imaging place, and that report needs to get in their chart. Orders coming in, that kind of stuff. Nursing home reports. We get just a wide variety of faxes that come in. We bring them in electronically. We're able to tag that folder so that when anything comes into that folder, it automatically gets uploaded to the Luma fax solution. That generates a list in Fax Transform that then our HIM team reviews, approves, and then it automatically uploads into the chart without them having to actually use the upload routine. So the other nice thing about it is we were able to set it up so that it automatically tagged the provider. So the AI is reading the
nice.
facts, figuring out which provider it needs to go to, populates that information in the fax transform fields. So that way we can use those fields to then upload it automatically into the chart. It gets in the right chart. It notifies the provider that there's a new document there. And the HIM team, instead of spending hours working through this, she's spending about 15 minutes. So it's been
That's
a game
great.
changer for her. Yeah.
Hey, Sam, I have a question real quick on what you're saying, Kurt. So, what would you say are just to label it in your brain? What would you say are the unique differentiators of what you're experiencing right now, as opposed to something like an e-fax or a write fax, or a generic electronic fax solution versus what you just described? Because a
Sure.
lot of times, and the reason, if you could unpack that, is we have many folks that are living in that current state of an e-fax or write fax, and they don't understand what you just described. So if you could kind of lay out what really is different, and why should they think about making that leap?
I mean, those other solutions you're talking about there, they are really just generating a work list for the end user to work from. They still have to open every fax. They still have to figure out who the provider is that this is supposed to be going to. They still have to search and find the right patient, look up the right MRN, their medical record number. So there's still a lot of process that they're having to do with this solution. Yeah, it's all contained in, one work list for them to work from, but why not utilize some AI to read that fax for you and to fill out 95? Honestly, I think our number with last time we looked was about 97% of our faxes gets at least some of the fields filled in automatically, that she doesn't even have to review it. She can just, yep, looks like the right patient, the right providers for that patient, submit it and move on. So
Yeah.
utilize some of the AI tools that are available out there to simplify your job.
So
And
what?
like get rid of that BS like busy work, right? Like no one wants to sit there and like look through everything, make sure you're copying the numbers correctly, whatever. Like why not have the computers work for us and do that work so that you're freed up to do other stuff
Yeah.
that matters more, right? Can you walk us through what your staff is able to work on now beyond like besides that busy work that they were initially working on and spending hours on?
Right. Our HIM team is patient facing for us, so they get requests that they may need a copy of their medical record because they're having to go to a specialist in Lincoln, Omaha, wherever. So they have some patient facing tasks that they have to handle. They also handle our portal. So, if we get questions from patients about the portal, it just opens up more of their time to be more progressive instead of just task oriented over and over.
Sure.
I'm dealing with these faxes. So I think it's more of just giving them more time back in their day rather than
Mhm.
we've added additional tasks to them, because we really didn't. It's a better tool for them to use. So we sharpened their tools.
When
Yep.
you started, what was the success metric that you thought would be good enough?
Aditya did tell us that he thought we were going to be above 90%. And I'm like, ooh, that's pretty high number. I thought if we could be at 75%, I thought that'd be a pretty good number. And another thing with healthcare faxes is they're not standardized. It's based
Of
on the
course.
EHR.
Yeah.
And so for the AI tool to be able to read that fax and gather information out of it, when it's not like it's using. I'll go with some old school here for you, the Monarch. Monarch's a piece of software that can read electronic reports, but
Yes.
it has to have that field in that exact spot. And the AI tool doesn't. One fax could have the medical record number on the first page, and the next fax could have it on the last page. But you know what? It finds it. That's very powerful.
What do you think that has contributed to any sort of difficulty in having fax transform play nicely with your EHR? Or like what do you think has been the hardest part of getting the workflow like set up and making sure that everything is being read properly, whether it is on the first page or the last page or whatever?
There wasn't a lot of setup on the AI piece of it. And the AI continues to get better, because as it continues to read these faxes, it is increasing its ability to find that information. So
Sure.
when the HIM team maybe has to split a fax because the one clinic sent 3 different patients' faxes over to us, it has the ability to split up a single fax into multiple patients so that can get uploaded to the correct patient. And so the setup of it wasn't very difficult. Just learning how the Meditech wanted the file name to be formatted so that it got
Sure.
uploaded to the chart correctly, and being able to tag the provider. That was the key. Previously, any of our uploads that we didn't tag the provider in it automatically. With this, we do. So the end user doesn't even have to tag the provider. It happens automatically.
That's great.
Kurt, how would you describe the ROI and value of this solution now? Because Sam had mentioned that we often hear, "Oh, we're saving now an hour and a half."
Yep.
Well, you're paying those people anyway,
Yep.
so there's really not, from that lens, ROI there. But as you're now experiencing this entire business process change, what would you label as the ROI of this?
Yeah, you're right. We're still paying the person to be here, but the satisfaction of our employees, is increased in it. We've made their job more efficient. So they're able to get their desk cleaned off at the end of the day. They're not having to come in the next morning and they have that pile of faxes on their desk that they couldn't get taken care of yesterday, that now they got to deal with today's faxes plus some of yesterday's. So anything that we can do to have more satisfaction as employees, that bleeds over into other facets of the hospital. Happier employees are better to be around. They're more engaged, whether it's in Meditech, whether it's in Luma, whether it's dealing with faxes, whether it's getting them through the cafeteria quickly. Let's make this place a place that people want to come work and make their job as efficient as possible.
And I will say, having eaten and drink at the cafeteria, the Phelps, if you're looking for a job, Phelps is out there and they're ready because they have quite a beautiful facility. And if I'm remembering correctly, all the drinks were free. So all the soda or pop you could ask for was free. And that was this music to my ears. So just saying, I don't know, we'll have a plug at the end for any open roles you have. We'll get
There
that
you
going.
go. You know what? You're 100% correct on that, Sam. One of our perks is all the fountain pop you can drink. So I don't know if that's a good thing, but I'm a one pop guy in the morning. I'm not a coffee guy, but it's water the rest of the day for me.
So on that theme, over your left shoulder, you have play hard or go home.
Yep.
And I was admiring the, when you guys talk about your mission, your vision. Phelps Memorial Health Center is the first choice for healthcare.
Yep.
And so when I see that chart over your shoulder and I see something like that, my question for you, Kurt, is what was it that made the team so receptive to Facts Transform? If you decided tomorrow, Kurt, you know what, I don't want to do this anymore. No more Facts Transform. How much of a revolution would you have for the
Yeah.
folks that now?
I would have definitely our HIM team beating on my door right here saying, what happened to our Fax Transform? Amanda just called me earlier this morning, and
Amanda.
there was one fax sitting in the queue that didn't get processed, and she's like, "What do I have to do to get this processed?" And so we looked at it, and we just archived it, and I had to resubmit it, and it worked fine the second time. But yeah, she's in there every day, and multiple times a day she uses it. So she kind of processes our first thing in the morning, does some of those, and then as they come in during the day, she does another batch later on, and so it would be, yeah, they would be beating on my door. Where'd my fax transform go? That's for sure.
And the funny thing is, Amanda's like the nicest person, but I could see that side
Oh,
coming
yeah.
out of her and
Oh,
being
yeah.
very upset at all of a sudden, hey, surprise, you now have hours more worth
Yes.
of work to do. No, I'm on Team Amanda here, so we'll get Fax Transform set up for her.
To be like,
Yep.
better off dead. I want my $2
Exactly.
every morning.
Yeah.
Kurt, where is it?
They weren't directly asking for it when I came to them the first time, like, hey, this is a solution that we can use. But they were receptive to it, and they're like, yeah, let's try it. And honestly, I helped her the first day, maybe two. And then the third day I contact her. I'm like, hey, you need any help with this? And she's like, nope, it's easy. I can do it. And she ran with it. So I very rarely hear from her anymore. I always take a look, make sure that, everything's going through for her. But yeah, she handles it all on her own.
Rockstar. I love it. Okay,
Yeah.
so we've heard you do a lot of advocating for your team and for your patients and everyone who's coming through Phelps. If you were to describe your leadership style as a movie, how would you describe it? Or what movie would you choose as your leadership
Ooh.
style?
That's a tough one. I like to enable my people to be able to do the best that they can do. Whether it's my team here in EHR, whether it's the other teams throughout the hospital. So it would have to be some type of teamwork. Um, you know, Maybe, but there is that a little bit of craziness in there. So maybe Major League, that might be
Nice.
a good movie to describe. But so think of me as the manager of the team that's got to kind of herd all these different groups together. But in the end, we're all trying to get that win.
That is
Nice.
a great movie.
Love Major League.
The amount of quotes, nice fastball, sounded like it. Dornan, it says here in my contract I don't have to take ground balls. And then you know what the manager does. Sam, you wanna rock through some rapid fire questions?
Yes. Okay, Kurt, are you ready? Because I'm gonna
ready.
go so fast and you're gonna bring the heat. Okay. What would your walk-up song at a healthcare conference be?
100% Enter Sandman.
Yeah.
Oh,
Nice.
yeah.
Okay.
We're going big.
Oh,
Yeah.
really well. Nice. Okay, when friends visit you in good old Kearney, Nebraska, where's the first place that you bring them? And I think I might have a clue because if it's that restaurant that we went to with those steak tips, I think that's going to be my answer. But where would you bring them if you were having people in from out of town in Kearney, Nebraska?
Well, it would have to be Cunningham's on the lake where I took you guys. But as a snack before we got there, I would have to take them to Runza. So Runza's a fast food in the area. It was started in Nebraska here, and it's a cabbage burger is what it is. Anytime you're coming through Nebraska, my brother lives in South Carolina, and the first place he stops when he leaves the airport when he's coming to visit, he stops at Runza. So I got to give a
Nice.
shout out for Runza as well.
Renza, not sponsored, to be clear, Renza. But Renza, hit us up though. Maybe we'll have some sort of a like
That's all right.
collaboration. We can make it happen. Okay, Kurt, if you weren't in healthcare, what would you be doing?
100% I'd be a farmer. I grew up on a farm. I still have the farming blood in me. I have a little garden in my backyard to kind of tease myself.
What do you think is the least respected vegetable and why?
Well, Brussels sprouts get a bad name. Brussels sprouts made correctly, they are so good. Some of my cured bacon sauteed in there with them. Oh yeah,
great.
and then you have to make them on the grill and just
Cast iron?
Yeah,
Iron? You throw a cast iron on there?
I do cast iron sometimes. A lot of times it's just in a foil pan, but definitely on the grill.
There you go.
Okay, nice. With some of that homemade, that's really solid. Okay, last up, what is your go-to karaoke song? And I don't think it would be Enter Sandman, but
It would
you
not
tell
be Enter
me.
Sandman. No, I can't pull that off, that's for sure. But I thought about this one a little bit, and this is going to be kind of out of left field as well. I'm a huge Van Halen guy, but
Nice.
Ain't Talking About Love is one of my favorites that Van Halen has. So I'm not a big karaoke guy. I have face for radio and a voice for not karaoke, but yeah, Ain't Talking About Love is one of my favorites.
Love it. Rock on, Kurt.
There we go.
There we go. We're going to have to cut that. We're not going to be allowed to play that at all. We could not afford having that
That's
on this
me
show.
playing guitar. That's me.
Oh,
That's you?
Well, in that case,
That is
maybe.
me playing guitar. So, Kurt, whenever you come to Denver next, we're going to go in my basement and I'm going to let it rip for you.
All right. That sounds
only
good.
if Kurt brings some of that bacon, because I feel like that's like a jam session. That's going to be the perfect combination.
It 100% would.
So, Kurt, thank you for your leadership, for the constant innovation. I think it's remarkable, and we just appreciate you so much. So great. We're so grateful for everything. My final question for you, okay?
Yep.
The final question would be, how should a steak be properly cooked?
Yes, 100% reverse sear to a medium rare, so a hot pink center. And if we can do not just the center, but like hot pink, except for a little cast iron sear at the end, that is delicious.
Well, you're clearly the person to know. You're amazing. Thank you for everything. We're so grateful for you. And I mean, I don't know, 2032. I don't know. I mean,
yeah,
I be looking back on this little podcast going, that's what got it going.
Honestly, the way, I mean, I don't know, maybe at the end, should we do like a salute at the end, or like, I don't know how you like end a call with a city council person, like when you can't shake their hands. So I don't know, maybe we'll just do a quick like sign off to Kurt and all he does.
Maybe a fist bump.
Yes.
Oh, sure. Yeah. Like a little fist bump. I like that.
2, hold on. It's like rock, paper, scissors. So you go 1, 2, then you do it. Okay.
I'll take my rings off. That'll be good.
2, 3.